Hey everybody, welcome back. There was no sound, so I think I got to start from the top. Everybody, welcome back to another episode of Doctors Go Live. I'm Nina Shahril Khan, your host, and today we're going to be talking about a disease that everybody always assume happens to the elderly. But guess what? Today, even people in their 30s and 40s are being diagnosed with this serious condition. So we are talking about heart disease, which is no longer just a disease for the elderly. And in this episode, we're going to be covering what puts young adult at risk, how we're going to learn the early warning signs and what you can do to prevent the disease. So, welcome everyone, Susan, Lutz, Joseph, and thank you for telling me there was no sound. And to answer us, the expert who's going to be joining us today will be Dr. Prem Nathan Arumuganathan, consultant interventional cardiologist from Columbia, Asia Hospital, Bukit Jalil. Now, if you're tuning in, let us know in the comments where you're tuning in from and what you would love to learn in today's episode. So let us know. You feel free to use the comment section. Okay. And of course, we also have the quiz questions right at the end. And today, if you're excited to win some amazing prizes, if you love quizzes, if you share this video out, you're going to be eligible to join our Doctors Go Live quiz, which is happening right at the end of the Q&A. And today, we've got 3 heart screening packages, which is worth 749 ringgit up for grabs. So who wants to win? Let us know in the comment. Hello, Pusbarani. Okay, so now hit the share button, tag your friends, stay with us all the way till the end. You might just be a lucky winner with a healthier heart. Now, all this is happening right here on Doctors Go Live with me and our special guest for today. But first, let's take a look at this video.
Heart disease is no longer a problem just for the elderly. More and more Malaysians, younger Malaysians around the age of 30 to 40 nowadays also get diagnosed with a lot of serious heart conditions. But the good news is, with early detection, lifestyle changes and medical advancements, we can drastically reduce those risks of having heart attacks, strokes, as well as potential long-term heart damages, provided it's detected early. I'm Dr. Prem Nathan Arumuganathan, consultant interventional cardiologist from Columbia Asia Hospital, Bukit Jalil. Now I would like to invite you for the next episode of Doctors Go Live. I'll walk you through how heart disease is evolving, warning signs to watch out for, and how to take charge of your heart health. It's all happening on Thursday, 29th January at 3 p.m. Whether you're young at heart or young at mind, be sure to catch it. Trust me, your heart will thank you.
Hey everyone, welcome back to another episode. Today we are talking about heart disease and how it's no longer just a disease for the elderly. Sukhdev, I hope the audio is clearer right now, but let us know in the comments. And thank you for letting us know where you're tuning in from. All right. So today we're talking about heart disease and how it's no longer just a disease for the elderly, and it's showing up more and more in younger Malaysians. So what can we do to stop it? Here joining us to break it all down is our special guest, Dr. Prem Nathan, consultant interventional cardiologist from Columbia Asia Hospital, Bukit Jalil. Hey, Doc. Thank you so much for joining us.
Can you hear me? Can you
Oh,
hear me?
yeah. Very, very
Oh,
loud and
great.
clear.
How
So
are you
then let
today?
us know. I'm good. How are you?
I'm good, thanks.
Okay. So you are live with us from Bukit Jalil, right?
That's right. That's right.
Okay.
I'm in
Now,
Columbia
before
Asia
we go,
Hospital, Bukit.
Bukit Jalil. Okay, got it. Now, before we jump to the questions, a couple of reminder for our audience at home. Right at the end of the show, we have our Doctors Go Live quiz where you could win some exciting prizes. So please pay attention to Dr. Prem, what he shares today, because you could just win those special screening packages worth 749 ringgit. Now, also, if you have a questions, please let us know in the comment. We're more than happy to answer it during the Q&A. So let's get started. Doc, welcome. Can
Yes.
you please share with us a little bit about yourself and what you do at Columbia Asia Bukit Jalil?
Hi, everyone. I'm Prem Nathan. I'm a consultant
Okay, can you guys hear? Because we just got cut off.
interventional cardiologist. I try to put in stents and balloons whenever there are any blockages in the blood vessels.
Okay, got it. And what inspired you to get into cardiology? Was there a defining moment or a personal story?
I don't think there was any particular defining moment. I do remember, however, being in medical school, learning about the heart, finding out that it's a very unique organ. It's just as small as our fist, but it does so much work. It's like the engine in our body. It ensures all the other organs in our body receives sufficient amount of blood. And also from a practical point of view, when you review patients in the ward who've suffered a heart attack, that is a defining moment for them. And them having undergone, for example, cardiac event like a heart attack, and then that's like a wake up call for them, and they are willing to share that moment with me at that point as a
Mm-hmm.
medical student, and realizing that wow, a patient who suffered a heart attack is using that as a positive impact to make positive lifestyle changes. That's when I realized, okay, this is what I want to do. I want to be in that journey with them as they improve their
Wow.
life. Yeah.
Okay. And since we're talking about this episode about heart, you've spent like how many years now in in this area, cardiology? What is it that you know that a lot of people out there don't know that you want them to know?
So I think it's just a human nature thing where all of us think that we are invincible, that we are never going to get a heart attack. You
Especially when
might
you're
be,
young, right?
especially when we are young.
Yeah.
And the thing is, most of us never think we are old enough. So
Uh-huh.
I think that's one biggest hurdle that we all have to, I suppose, face. And I
Mm-hmm.
think when we think that we are invincible, we tend not to take care of ourselves enough, and we don't actually regularly do health checks. And I think that's where we tend to miss the plot. And on one fine day, unfortunately, hopefully it never happens to you or anyone else, but eventually some of us do get heart attacks, and that's when we start questioning, why me, why did this happen to me? And then that's when your doctors go through and run through all the blood investigations, and they
Mm-hmm.
tell you, lo and behold, you've got high blood pressure, you've got high cholesterol, you've got
Uh-huh.
diabetes on top of the heart attack. So it can be quite daunting for some patients. Yeah.
Mm-hmm. Right. Okay. Right. So now, I think now it's a wake up call. So whatever your age, you better listen up. Okay. Also, before we go into today's topic, I heard that Columbia Asia Bukit Jalil recently launched a brand new cath lab. Could you tell us what that is and why it's a big deal? A cath lab. What is that? You know.
So it's a brand spanking new cath lab, and we
Uh-huh.
officiated it on the 15th of January. And on the
Wow.
very
Brand
same
new.
day, we had a patient who came in with a young gentleman, only 40 years old. Never
Mm-hmm.
knew he had diabetes, never knew he had high cholesterol, just had chest pain 2 days prior.
Mm-hmm.
And we found out he had a heart attack based on his ECG changes as well as his blood results.
Mm-hmm.
And we had to bring him into the cath lab. So a cath lab is basically an area where we investigate by performing an angiogram. We inject some
Mm-hmm.
contrast or dye or ink into the
Mm-hmm.
heart's blood vessels.
Mm-hmm.
We confirm the position of the blockage if it's more than 70%, in which case this gentleman had a narrowing of more than 80%. We put in a balloon and we opened up the narrowing and we re-established the blood flow. And thankfully, he did well. His symptoms improved, and he was discharged 2 days later.
Mm-hmm. Wow. Okay. So, what is this lab able to do and help patients where it was not possible before? Just wondering. I think we got cut off. Okay. Did you get the question, Doc?
Yeah, I did. I did. Did you hear my answer?
Okay.
No?
No, we could. I mean, I missed it. I don't know about you guys at home. Please let us know. But if you could repeat it.
Okay, sure. It was a
Mm-hmm.
young gentleman, only in
Uh
his
huh.
40s, who
Uh
had
huh.
some chest discomfort, about
Okay.
chest pain for about 2 days prior to admission. And when he came
Oh,
to our emergency department,
we got that one, but I also asked another question, which was, what is it
oh,
that
I
that
see.
cath lab able to do? What kind of procedures can now be done, which otherwise was not possible?
So with the cath lab, we can actually perform invasive procedures for the heart, like an angiogram, which is a diagnostic procedure that
Mm-hmm.
confirms as to whether or not a patient has a narrowing or a blockage in the coronary arteries. So that's a
Mm-hmm.
diagnostic procedure. Now,
Mm-hmm.
this coronary angiogram can also become a therapeutic procedure whereby we call it an angioplasty. So we perform angioplasties for patients who have blockages more than 70%. We put in
Wow.
balloons or stents
Uh-huh.
depending on the size of the blood vessels. And the idea behind this is by opening up those narrowings or those blockages, we re-establish blood flow and the heart receives its normal blood flow back again, and the heart is as good as new.
Wow. Okay. So, what does this mean for patients then? Is it like you don't have to go for surgery, or it's shorter, simple procedures and faster recovery? Just wondering.
True, it is faster recovery compared to surgery. Surgery
Hmm.
still does play an important role. For example, for patients who have a lot of blockages, multiple blocks in their heart, or
Hmm.
more complex lesions, yes, these patients do benefit from surgery. But for patients who have only one or two blockages, they don't need to go for surgery. Just by having this angioplasty done, they just stay in the hospital for another 1 or 2 days post procedure and they can be discharged well.
Wow, that's amazing. That is this like a new chapter for cardiac care then, in Malaysia? Just wondering.
It's it's been there for the past 20 years in Malaysia, even 20 plus years. In fact, the first angioplasty was done about 40 odd years ago, 1977, if I'm not mistaken.
Okay, fantastic. So let's get into the topic then. So today we're talking about heart disease. Why it's important to have this conversation is that what is it that you want the folks at home to understand before we begin? Like really get them to
Right.
understand. Mhm.
So I think the take home message for today at the end of this talk would be that you understand what are the symptoms of heart disease, what are your risk factors. So roughly you can gauge, do I have risk factors of having heart disease? If they are, what do I need to do about it? So taking appropriate measurable actions in order to reduce your risk of having heart disease, and not being ashamed to get help from a cardiologist.
Okay, got it. So I think one of the biggest problems and challenges is that we don't know when it's a symptom, right? Is that right?
True. Yeah,
Okay,
that's
so
true.
that's
That's
what
really
we need
true.
to focus on today. Yeah?
Yep.
Okay. So it's no longer a disease for the elderly, heart disease. What is actually happening, doc?
All right. So heart disease in Malaysia is no longer just a disease of the elderly. Gone are the days where we think only pensioners and retirees have heart disease. No, nowadays we see a lot of younger working individuals being afflicted with heart attacks, unstable angina, and we have strong evidence to indicate that Malaysians are actually experiencing acute cardiovascular disease, or ASCVD for short, about 10
Mhm.
years earlier compared to long, long time ago. And when we compare this with our developed countries, though those patients in other countries, they have these kind of conditions in their 70s, their 60s. But in Malaysia, unfortunately, there's a significant number of cases occurring in patients below the age of 50s, even in their third and fourth decades.
Okay, that is quite alarming, isn't it, doc? Just checking.
It's very
Yeah.
alarming.
Is
Uh,
it just in Malaysia or globally? Because it sounds like it's just in Malaysia, right?
I think in Southeast Asia, it's mostly Malaysia. Yeah.
I know
Of
we're
course,
leading in terms of obesity. That's quite
yes,
confirmed.
definitely,
Yeah.
definitely. But when you compare with
Yeah.
other countries like the European countries, their heart patients are usually in their 60s and 70s. I remember when I did my 1 year of training in the UK, my heart patients were all in their 70s and 80s. You know, it's such a huge change compared to treating patients in Malaysia who are so much more younger. So there's definitely a difference there.
Okay, okay. So that is quite alarming. In terms of trends and statistics, what else can you share with us? Yeah, and especially when we talk about young Malaysians, like how young are we talking about, and what's the number, kind of thing?
Sure. More than happy to share these trends and statistics to alarm you even further.
To alarm us even more. Nothing quite like to scare us into action, right, Doc? Okay, we lost Doc for a
Yeah.
minute there. Okay.
I think we got
Uh,
lost for a while there.
yeah, okay, but never mind, Doc. Could you share with us some key trends and statistics so that we
Sure, sure,
understand this is a huge problem?
sure. So, nearly 1 in 5 heart attack victims in Malaysia are below the age of 40. More than a third of heart attack deaths or fatalities in Malaysia occur in individuals under the age of 60. Now, the leading cause of death in Malaysia, regardless of whether you're male or female, is still heart disease. You know, and the
Mm.
average age of patients undergoing intervention, like I mentioned before, where we put in balloons and stents in Malaysia, is at 57, whereas in Japan is at 71. That's more than a decade
Wow.
difference. You
Yeah,
know,
almost two.
so yeah,
Yeah.
it is scary indeed.
Okay. Kind of thing. So I guess we're not heading in a good way, right? Kind of thing. And I guess the next question is, Doc, why is this happening? I think we need the next. Yeah. So why are
Right.
more young
So
Malaysians at risk? Is it the food and our mama, our lifestyle? What's happening, Doc?
it's you're right there. It's a combination of all of the above. You know, young Malaysians nowadays lead a sedentary lifestyle. You know, you can't blame them. They are constantly overworking sometimes. You know, when you finish work and go home, you're still working. You still get messages from your colleagues and your bosses via WhatsApp. So that sedentary lifestyle, all that stress accumulation also makes you want to, throw caution to the wind and just order food whenever you want to. You just use your whatever apps you have on your phone and just order food. It's just as easy as
Mm.
that. So as a result,
So
this leads to obesity, a lot of unhealthy diet. At the same time, I suppose as part of stress management, a lot of young Malaysians are smoking and vaping. And the thing about vaping is that a lot of them think that it is a more healthy option compared to smoking. And the truth is that's actually quite wrong. Just
mm-hmm,
recently, I had a patient in his mid 30s, very fit
mm-hmm.
gentleman, came in with chest discomfort, and the only risk factor he had was that he vapes.
Vaping. Wow.
Yeah, so I was
Okay.
quite certain that he didn't have chest discomfort, but I told him it's best that we do a scan, a CT scan,
Mm-hmm.
because based on
Mm-hmm.
his symptoms, they are very typical of chest pain or angina. And sure enough, his CT scan showed that he had some narrowings in the heart, some calcification or hardening in the blood vessels in the heart. So, no, vaping isn't all that safe as it's assumed to be. So, a combination of all of this can lead to why Malaysians are being younger. Malaysians are getting heart disease nowadays.
Wow. So it sounds like, the overworking, because we're, as Asians, we're not very good at saying no, especially to our bosses. And we pride ourselves in being very hardworking, right? So our
Very
boundaries, and yeah, from compared to our Western counterparts, I guess we're not very good at saying no to work, right? And then that impacts the lifestyle, the eating, the food. Kind of thing, and of course, dealing with the stress and everything. So I guess we
yeah,
need to do better in that, right? Doc? Anything else you can
definitely.
share? Yeah, so I
So
guess
if
this
I
explains. Yeah.
Yeah. So like you mentioned before, yeah,
Mm-hmm.
all this has been mentioned before. How Malaysia is leading. It's a leading nation in Southeast Asia when it comes to obesity. Something very
Yeah.
unfortunate. Something that we shouldn't be proud of, and we really need to look into all these factors. Why is it that we're getting overweight? Why is it that we are leading a sedentary lifestyle? Stress management is
Mm,
also equally important.
yeah.
Work longer hours contributes to poor quality sleep. You can never underestimate the quality of sleep. Now, this in turn
Mm.
leads to high blood pressure, and there's a condition called broken heart syndrome, which we do see quite commonly
Broken
nowadays.
heart, as in the heart
Syndrome,
breaks.
yeah,
Wow, what is
as in
that
like,
about?
the muscle of the heart just gets weak, and
Mm-hmm.
these patients actually require medications to improve their heart function. So, all this also can eventually result to heart conditions. And of course, the
Wow.
last one here, undiagnosed conditions. A lot of Malaysians don't
Hmm.
know that they have high blood pressure or diabetes or cholesterol. They only seem to know about it when the doctor has diagnosed them with a certain condition. For example, when I diagnose my patients with heart attack, I'm just adding more fuel to the fire by saying, look here, you also have got diabetes, you also have got high blood pressure. Didn't you know
Mm-hmm.
before? The majority of them don't. So
Wow.
that's a
Okay.
sad thing.
Okay. Yeah, so all these things just kind of snowballs, right, Doc? Kind of thing. All right, let's
True.
take. By the way, before we continue, if you have any questions, let us know in the comments section. And of course, there's also the quiz happening, so pay attention to Doc because you could win yourself a health screening package worth 749 ringgit. All right, let's continue. And you mentioned that symptoms are often dismissed, right, Doc?
Yeah, that's true.
Why?
I
Yeah.
think I think a lot of younger people tend to think, as I mentioned before, that they are not going to get a heart attack anytime soon. You know, they're
Mm-hmm.
strong, they're invincible.
Mm-hmm.
Yeah.
Mm-hmm.
So what that leads to is that they tend to misinterpret their symptoms. They tend to overlook their symptoms. For example, when I get young patients coming in with chest pain, they normally come and see me after about a week or two of having that chest pain. They go to a
Mm-hmm.
GP a bit late as well, and they think that they have some gastritis symptoms, or they feel that maybe they have pulled a muscle, you know. And then when I tell
Instead
them
of a
you've been having,
chest pain. That's what they
yeah,
think they're having. Okay, wow. Okay.
yeah, they find it very difficult to fathom the idea that they may actually be having a heart attack. You know, so that delay in seeking medical attention can also result in more severe outcomes. Imagine those patients who don't even present to the hospital. You know,
Wow.
we've
Okay.
heard of cases of sudden deaths at home or while playing sports. You know, these things are
Wow.
not
Okay.
unheard of. It's quite common actually nowadays.
Yeah, it is. It is kind of thing. And they like to go straight to the GP when I think it's better to go straight to the emergency, right? Because there's quite a lot of people who lost their lives because of the time that it takes for
So,
them to take action. Okay. So, yeah. So, speaking of this, because the symptoms are often dismissed, could you share with us what are some of the warning signs, especially for people, the ones that people shouldn't ignore?
sure, more than happy to. So these warning signs are something that all of us should be aware of. Yeah. So the most common warning signs of a heart attack or an angina is central chest pain. It's usually described as a heaviness. You feel like someone is sitting on your chest. It can either be on the center part of your chest or on the left side of your chest. Yeah. And the term angina itself is Latin for strangulation. You feel like someone is strangling your chest or your throat, right? Because there can be radiation of pain to your jaw and even to the left arm. And these symptoms usually last for more than 10 to 15 minutes. And together with that strangulation or sensation around your chest, it's usually associated with nausea, vomiting, even excessive sweating, and even dizzy spells. Some patients complain of palpitations. So they're a bit confused because they are sitting down, maybe, and they're having all these symptoms and they feel like they're running a marathon, you know? So these are symptoms that you
Mm,
need to watch out for. However, for diabetics or for patients with diabetes or poorly controlled diabetes, because diabetes can affect your nerves, the symptoms may not be as typical or as clear cut. So, for patients with diabetes, you must understand that the moment you have diabetes, your risk of having heart disease is already higher compared to someone without diabetes. So even if you have vague symptoms around your chest area, or you have just mild shortness of breath while at rest, which you shouldn't be having, yeah, try to seek attention as soon as possible. If the hospital is too far away, even a GP clinic is good enough nowadays because most GPs nowadays have got facilities to perform ECGs, and a lot of GPs
mm,
nowadays have have no qualms in picking up the phone and referring straight to the cardiologist or to the nearest emergency center. Another
okay.
very important point is that women may tend to have symptoms that are not so typical, but even nowadays, a lot of doctors are well aware that the number one killer for women is still heart disease. So even if
Okay.
you were to have vague symptoms around your chest, tightness, nausea, vomiting, don't don't hesitate. Just go to the nearest health center, be it a GP clinic or an emergency department. Get an ECG. Get an MRI done.
Get an ECG. Okay. Are we still clear? Are we back? Okay, got. So, are there
Yeah.
certain special symptoms that women have that was, quite surprising, not typical? Just wondering.
So they do have palpitations, a lot more palpitations, right? They might
Mm-hmm.
feel tired, right?
Mm-hmm.
Lethargy could be also there. So they're not so
Mm-hmm.
typical, but
Mm-hmm.
don't dismiss it. So as I mentioned before, I
Okay.
think before we got cut off, you need to at
Mm-hmm.
least get an ECG and please
Mm-hmm.
get a blood test called a troponin, which is a cardiac enzyme marker. If you forget
Okay.
anything at the end of this talk, just remember if you have the symptoms, please go to the nearest center, medical center, get an ECG, and get a blood cardiac marker that your doctor will know
Mm-hmm.
what to do for you. Get that done to make sure that we don't miss a diagnosis of an angina or a heart attack. All
Okay,
right?
got it. Well, if you guys forgot, you can, watch this episode again at 27.28 minutes kind of thing. Okay? Very easy and take note of it. All right? Right. Let's take a look at the next slide. Okay, so we already know the warning signs, but are there any ways that we can prevent, kind of thing instead of, or
Def-
anything we can do to reduce the risk?
Definitely. Prevention is definitely better than cure. So the
Mm-hmm.
first and foremost thing you all need to do is sit down with your family members, sit down with your uncles and aunts and your parents, and get a thorough family history. Right?
Mm-hmm.
Ask your family members whether there's history of heart attacks in the family, not just heart attacks but also strokes as well, because the strokes and heart attacks more often than not go hand in hand because they are due to blockages in either the brain leading to a stroke
Mm-hmm.
or to the heart leading to a heart attack. So these two important factors, find out about history of heart attacks and stroke in your families.
Mm-hmm.
Another very important thing is ask your family members if, say, for example, among your male family members, brothers, male cousins, uncles who have passed away suddenly below the age of 45, not due to an accident, of course, below the
Uh-huh.
age of 45 for male relatives and below the
Mm-hmm.
age of 55 for female relatives. More often than not, if they were to pass away suddenly at a very young age, more often than not, the cause is cardiac in origin. It could have been a heart attack.
Wow.
So that's
Okay.
very,
Got it.
yeah. So, yeah.
When we say ask family members, do you mean like your immediate family? You include your cousins, as in your dad and mom's siblings, and that's good
You
enough,
include
or
your cousins,
cousins?
cousins as
Okay.
well. Include your first and second degree relatives as well.
Okay. So first and second degree on both sides, right?
Yeah, that's right. Both sides, both paternal
Okay.
and maternal.
Okay, and you mentioned that earlier, that genetics and family history, from the sound of it, is, I mean, you don't mess with that. It really affects, and gives you a clue. How is that? And which kind of sucks, right? If you're born with really bad genetics, is there anything one can do? I mean, number one, why, and number two, isn't there anything one can do? Just wondering.
I think maybe you don't have to focus so much on the why. It might lead to very
Yeah, yeah, yeah.
existential questions and all. But
Uh huh.
I think what we can do is that, uh, sure, we can't run away from genetics, but I suppose at least if you know that you've got higher risk of having heart disease, that knowledge is actually power. You can do something about it.
Okay. I think we got cut off again, so let's just wait a couple of minutes. In the meanwhile, Doc, we lost you again. So you were saying just the last
Yeah.
part, I
So
think.
uh, yeah. So I think you need to get, yeah. So now that you got that family history there, you've got the knowledge, right? You've got that power.
Uh huh.
You've got that additional understanding that you are at higher risk. So you need to do something with that knowledge, right? So that would help you to seek medical attention a bit earlier, to get your regular screenings done, to do an ECG if you've never done one before, to get a stress test done. It also will motivate you to lead a healthier lifestyle. You know that you don't want to be another statistic in your family, right? So
Yeah,
that will
yeah.
motivate you to change your family, change your, not a family, sorry, change your eating habits. You can't
I
do
wish
that.
I could. We could change the family genetics and DNA. I wish, with the press of a button, that'll be awesome, right? Yeah. But I
Yeah.
suppose, I mean,
So I mean,
okay, because
yeah,
I absolutely agree with you because my dad's a doctor and we grow up, ever since we were kids, and they'll be, oh, you better be careful because you got it on your mom's side and your dad's side, and you got this, you got that, that, that. So we've been brainwashed since we were kids, right? Kind of thing. So I guess when you get the signs earlier, it'll help you lead a healthier lifestyle. So we see it positive, lah.
definitely,
Yeah,
definitely.
kind of thing.
And and also there are some genetic mutations that
Oh,
can
okay.
lead to higher cholesterol levels. So it's also important to check for your cholesterol levels when you go for a screening test. Most doctors, most GPs, even nowadays, do cholesterol screening. So get that
Mm-hmm.
done, especially if you've got high family history of heart disease. Get that screening
Okay.
done. That's actually going to be life saving for you in the long run.
Okay, and do you recommend having it like frequently or, over a certain cycle or period? What do you suggest, Doc?
So there are some patients who get it done very regularly, every 6 months. Then when I
Mm-hmm.
ask them, so you've been diagnosed with high cholesterol, have you done anything about it?
No, is it the
And they
answer?
say no.
Okay. What's
So
the point of
so
testing
so if you're
then?
not going to do anything about it, then you don't need to, right? So the idea is by major guidelines, okay, if
Mm-hmm.
you've done your cholesterol test and it's high, your doctor would advise you on healthy lifestyle measures. Eat more vegetables, more lean meat, exercise, and then after 6 months, you repeat your cholesterol test. If it's still high despite all those measures, then yes, he or she will advise you to be started on a cholesterol lowering medication. And then after
Mm.
another 3 to 6 months, they'll repeat the test to see how you respond to the medication.
Okay. Yeah,
So
that
roughly three
sounds
to
about.
six months interval.
Okay, so just to share with you guys what Doc is saying is that get your test done. If the results are not great, do something about it. Take action. Don't just keep having the tests done every 6 months because it's not going to change, right? Kind of thing.
Yeah.
Okay. We've got a lot of questions, Doc. All right, let's take a look at the next slide. So, what about the impact of modern lifestyle? Something must, as you shared earlier, it's affecting more younger Malaysians. So, could you
Yeah.
share with us a little bit?
So the thing about our modern lifestyle is it's good. I mean, it makes life a whole lot easier. That connectedness is good, but it can also be a double-edged sword, as we all know. You go back
Uh-huh.
home and your bosses are still, on your neck, trying to get deadlines
Uh-huh.
met,
Mhm.
and you have colleagues texting you. So all that constant connectedness leads to stress. Definitely, this
Mhm.
digital stress can affect your sleep. It can affect your mental health, your physical health. You feel too tired to even exercise. You feel tired to cook a healthy meal. You just want to click on your phone, an app on your phone, and order food to the house. We're all
Mhm.
only human after all. This idea of fad diets is also something that I've seen quite often nowadays. Some of it can be
Mhm.
quite scary, where I see
Mhm.
patients telling me that they're only eating lean meat or just meat.
Mhm.
Some
And
of
this
them
is the
lots of
keto diet.
keto diet. Yeah, they're hardly
Mm.
eating vegetables, and it's not just bad for your heart; it's also bad for your health, for your for your kidneys, for your cholesterol,
Okay.
all over. So I think if at
Yeah.
all you want to diet, by all means do it correctly, eat healthily. Occasional
Mm.
intermittent fasting is good. No one said fasting is bad.
Mm.
A lot of
Mm.
people know that there are benefits to fasting. So do it in moderation. And after you've done this test, these diet fads and all, these moments of dieting, try to just check on your bloods and see if there's a positive change in those blood test results.
I think that's a very good advice. Like, while, I mean, after you've done the diet for some time, check your health, get your health results done as well, because then you'll know whether it's impacting you positively or negatively, kind of thing. Because I find that a lot of people are doing the keto diet, but the founder actually died from a
True.
heart attack.
Yes.
That's what I read, right? Yeah, kind of thing. And social media also affects because
Yeah.
some people, if they're not stressed, I think they go and find problem and fight with people on social media, right? That sort of thing, I guess. Okay. So next we're looking at
Yes,
prevention
yes,
strategies,
definitely.
Doc. What can we
Definitely.
do? And this is advice for all ages, right?
yes, for all ages. And thankfully, these prevention strategies are easy strategies. It's just that the first step is always going to be the hardest. So just
Mm,
tell yourself you're doing this for a reason, exercise at least 150 minutes in a week, which is roughly 20 to 30 minutes in a day. Yeah, moderate intensity exercise should suffice. For example, walking, cycling, swimming. Do something that you like so that you can
mm,
maintain it all throughout. Healthy
mhm,
eating, definitely a balanced diet rich in vegetables, fruits, whole grains, lean proteins, healthy fats. Yeah, this can also help to reduce your cholesterol levels, improve your sugar readings, and also reduce your blood pressure. And also, we need to learn to cut down on processed foods, especially. This can lead to a spike in your
mm.
cholesterol levels.
And when you say processed food, what would that be, like breads and
So, like
all those cans?
all those chips and all the snacks that we tend to
Mm.
easily get access to nowadays. Yeah.
Junk food lah.
Junk food, yeah, junk food.
Yeah.
So another thing is also taking care of your mental health and stress management is equally important. So there are a
Mm,
lot of apps out there that teach you mindfulness breathing, breath hold, meditation techniques. All these are equally important. Adequate sleep is also very, very important for a healthy heart. Another thing you can do is just go for regular checkups. Start off with a simple screening test. Check for the usual risk factors. So the three main risk factors for heart disease. Of course, you can't do anything but genetics, but you can do something about sugar. So check your sugar levels, your blood pressure check, and your cholesterol levels. So most centers nowadays carry out these blood tests in simple packages that are very much affordable. Get that done so you know where you stand in the long run in terms of having heart disease. So at least get those simple tests done first. And if you've done that and the doctor suggests that you get an ECG done, which is an electrical reading of your heart, it gives us a lot of information about your heart health. These two tests are actually quite affordable. I advise that if at all you are worried about the finances of those tests, at least get a regular blood test and an ECG to know where you stand at least.
mm. And prevention is always much more cheaper than
A lot
sorting
more
it out
cheaper.
after. A lot more cheaper,
Yes,
kind of
true,
thing, right, Doc? Okay, cool.
true.
Next, let's look at. Oh yeah, this is again on prevention and action. This is a summary, I guess.
Yeah, yes, true. So I mentioned about how you can get your blood test done and your ECGs. So it's good to
Mm,
get your ECG done even in your 20s and 30s. I think thankfully in Malaysia, most pre-employment screening requires you to get an ECG at least, if I'm not mistaken, or at least a blood test. So you can pick
mhm,
up a lot of things from an ECG. And let's say if you have family history of heart disease and the doctor tells you, okay, your blood tests are fine, your ECG is fine, try not to stop there. Continue with your healthy lifestyle, and if possible, get a stress test. A stress test is an exercise ECG testing where we
mhm.
test the health of your heart. We want to know how your heart functions under stress. We put you on a treadmill and we try to get your heart rate racing up to about 80 to 90% of your target heart rate, maybe around roughly 150 to 180 beats per minute. Yeah, and we look at the ECG tracing. So these tests can be done, and these are the most basic tests that you can do for your heart health. So if you have family history of heart disease, you have family members, male members who've passed away below the age of 45, or female members who passed away below the age of 55, I would advise that you get at least this blood test and ECG done. If you have further concerns, you can get a stress test done. But these are
Mhm.
tests. The most easiest thing you can do is a balanced diet, do your own modified stress test, which is basically exercise, right?
Mm.
Exercise whenever you're free, stop smoking, stop vaping, and try to stay off social media for too long hours. Yeah, try to
Detox,
manage your stress. Yeah.
detox.
Detox, yes, digital detox. Yeah.
Yeah, I'm a sucker for social media. I mean, at least I admit it, right? Kind of thing. Okay, next, I think that we're innovations in treatment and prevention. Are there any new and exciting innovations in detecting heart disease early, Doc? Just wondering.
So yeah, sure. So there are a lot of blood tests that can be done. So some centers do offer blood tests like you might have heard of it, HSCRP, which is high sensitivity CRP. It's a marker that looks at your risk of having heart disease in 5 to 10 years' time. Yeah, but it may be a bit pricey. Yeah, so again, the simplest thing you can do is your routine blood test. In terms of medications, we have got a new host of medications which are actually combination pills. So latest research has shown that when you take combination pills like two-in-one pills for your high blood pressure or for your diabetes, it actually helps to improve your cholesterol level, sorry, your blood pressure readings at lower dosages. So there is improvement in that sense in terms of cholesterol lowering medications as well. We do have newer medications because some patients may develop side effects of statins like muscle aches and all. So there are other medications that can be given and also supplements that can be given together with statins to mitigate or reduce those side effects. In terms of technology, we have the wearable devices. A lot of my patients walk in with their funky phones and also watches as well. And they tell me my blood pressure was high at this point. My heart rate was very high at this point. I was very low while I was sleeping. So that gives me information about their heart health as well. So that helps me have easier conversation with the patient and tell them, all right, you need to do something about this now. You might have had the symptoms because your heart rate was high at this point of time. That helps me explain things a lot easier for them as well. And we can also
Okay, we got cut off. In the meanwhile, if you have any questions, please let us know in the comment section. Okay, because we're going to be finishing up very soon, and then we're going to go into the Q&A. And I've already got 21 questions. Doc, we lost you again. So you were just saying just the end part? Yeah.
Yeah, so we can easily pick up heart rhythm issues, arrhythmias, with this wearable watches. So that helps me diagnose patients a bit easier compared to those.
Okay, so those wearable techs are also very good, right? And it helps a lot for the patient? Okay, awesome.
It helps reassure patients as well.
Yes, that is good. My aunt, she's a worry part. She is young, but those things where you see the heart rate or the blood pressure. Yeah. So she wears that like all the time while watching Netflix kind of thing. That's not even wearable tech, right, Doc? Okay. So this will be our last slide. Yeah. So innovative screening tools. So there are new innovative screening tools. Could you share with us, Doc?
Yeah, so as mentioned before, the blood test CRP, it's a marker of determining your risk of having heart disease down the line. So now stress testing, as I mentioned before, this has been there a long time already. But now what we do is that we combine stress testing with an echocardiogram, which is an ultrasound of the heart. So that gives us a better understanding of your heart function, even at high peak exercise testing. So it's a combination test. And of course, nowadays we've got CT scans of the heart because some patients have got high risk of heart disease, especially among younger family members. And if they've got diabetes and they've had symptoms, I would normally recommend a CT coronary angiogram for this group of patients. We can pick up the anatomy, we can determine the location of the blocks, if at all they have any, and that will also help me determine whether these patients require further invasive procedures like an angiogram or an angioplasty.
Wow, that's awesome, Doc. Yeah. And I guess that's the end, right? Kind of thing. Yeah. But if so from this episode, because we're going to go into the Q&A soon, if there's one thing you want the viewers to take home from today's episode, what would that be?
Please get a proper family history. Yeah. Don't be ashamed to sit down and have a talk with your family members. Yeah, that is actually very, very important. You need to know where you're standing. You need to know how you're going to be, how you're going to feel in 10 years' time, 20 years' time. Don't feel afraid of taking blood investigations. If you do not want to come to a hospital, you are more comfortable with the GP, by all means, please, all doctors are there to help you. Please get your blood test investigations, get an ECG. And then, if at all you have symptoms, please come see a cardiologist. it doesn't mean that if you see a cardiologist, we're going to push you to the cath lab straight and do an angiogram or an angioplasty. It doesn't work that way. We are there to guide you to make sure that you do not have risk factors, or if you have risk factors, we will help treat those risk factors, and we will only suggest further testing if it's indicated. So first and foremost, talk to your parents, talk to the elders in your family. Yeah, exercise, do a blood test, and at least do an ECG to know where you
Do
are.
you get like this is just me wondering, since it's a family thing, right? I'm wondering if one person's get diagnosed, then shouldn't it be like the whole family should get tested as well to see where everybody is? It should be a
Yeah,
family
so
package, or yeah, it should be a thing,
it
to
should be a thing.
encourage people, right?
It should
Yeah.
be a thing. So normally when one family member has a heart attack, then everyone looks very morose and uncomfortable because they're all questioning, am I next on the list? That kind of thing. But it's something that you need to face up. You can't really just
Mm,
neglect that. So you have to do something
right.
about it.
Yeah, I think we should do this as a culture thing. So if somebody gets, it's kind of compulsory for the next and the second generation to kind of test as well,
Yeah,
kind
definitely.
of thing. Yeah. And for those who are already managing a heart condition, what message would you like to leave with them? Because I think the ones who have not decided to go for a test or screening might want to hear that there's hope. What's your advice, doc, to those with a heart
Okay.
condition?
So those with a heart condition, yeah,
Mm-hmm.
uh, please own up to the heart conditions. Yeah, you're not alone there. You're not the only one there. We are here to
Mm-hmm.
help. Yeah, go to any hospital or any clinic that you're comfortable with. Get those blood tests done. And if you've been diagnosed, don't worry. It's not a death sentence. There are so many things that we can
Mm.
do about it nowadays. We can treat it. It's treatable. It's curable. Yeah, don't shy away from asking for treatment. Your family
And the
members
trick
will
is,
thank you in the
yeah, and the
for
trick
actually
is
doing something.
getting it found out early, right? That makes the chances even
Exactly.
better.
That
Yeah.
makes it a
Okay.
lot easier.
So nothing to be shy about. Get yourself screened, all right? Kind of thing. All right. So, Doc, thank you so much. That was super insightful. If
Welcome.
you found today's episode very insightful, and also, Dr. Prem, I have to say, you explain it so simply and so clearly. I think that's why we got a lot of questions, kind of thing. So we're
Thank
gonna
you.
go into the Q&A shortly. But in the meanwhile, what was the biggest thing that you learned? Let us know in the comment section. For me, definitely, I'm shocked by the how young we're getting, especially numbers in our 30s. Yeah. All right, so let's go into the Q&A. First question is from Lutz. Lutz asked a lot of questions. Thank you, Lutz. So he has no problem when he jog, but when he rests, he finds himself lack of oxygen. He is 63 on hypertension medication. Normal heart screening did not reveal any serious issue. Wow, doc, this one like very confusing question. I also would like to
Yeah.
know what's going on.
It's actually a very good question. Yeah. So when we do a stress testing, yeah, we don't just monitor your heart rate or your heart rhythm during exercise. We also continue monitoring your heart rate even into recovery, meaning once you stop exercising, the ECG machine will continue tracing your heart rhythm. So what you're experiencing right now, Mr. Lutz, is that you are having symptoms while you're in recovery, right? It could be at recovery, yeah. And finding yourself lack of oxygen. Now, that does not necessarily mean it has to be a cardiac condition or a heart condition. It could also mean that you may have a lung condition as well, right? So I think it's best if you see a doctor and get that tested, right?
Mhm.
Maybe a simple chest x-ray would do, yeah? Because if you've done a normal heart screening, and by normal heart screening, I would believe that you've done an ECG while you're resting and also some blood tests. If you've not done a stress testing, then I advise you to do an exercise stress test so we can actually monitor what happens while you are in recovery, which is when you are finding yourself lacking of oxygen. Another very simple test you can do is a chest x-ray, x-ray of the chest to look at your lungs to make sure you're not talking about a lung issue here.
Okay, got it. Thank you, Doc. Next questions, we have Mobina's question. Mobina is saying, are we seeing different disease phenotypes in younger cardiac patients compared to older ones? I think you might need to explain the question because some of us don't understand it. What does
So
phenotypes mean? Just in
phenotypes,
case. Yeah.
sure.
Mm.
Again, a very good question. So phenotypes are basically
Mm.
characteristics. So when it comes
Mm.
to
Okay.
younger cardiac patients. All this while, I've been talking about heart attacks, right? I've been talking
Mm-hmm.
about blockages in the blood vessels of the heart. Younger patients can also have
We got cut off again. I was so looking forward to the answer. Let's just wait a little bit. In the meantime, if you have any, Doc, are you back?
I'm back. I never
Okay,
left.
so you, yes, you never left, but your voice and face did. I mean, froze. But anyway, you were saying?
Yeah, so when it comes to younger patients, what they normally have
Uh-huh.
is that a rhythm issue. So our heart has got two electrical generators. Yeah,
Uh-huh.
so our most of my younger patients come to me with complaints of purely palpitations. And when these
Mm-hmm.
palpitations or fast heartbeats go on for longer periods of time, yeah, these group of patients tend to have an issue because of their electrical rhythms or circuits in the heart. So this is not so much of a blockage; it's more of a irritation or a issue with their electrical circuits in the heart. So
Mm-hmm.
these group of patients tend to also be a bit heavier, a bit more obese. Yeah,
Oh, okay.
a lot of them seldom exercise, and to be honest, a lot of them also have newly diagnosed diabetes. So there's a bit of an overlap in terms of characteristics because nowadays even the younger patients have got quite well established diabetes and high blood pressure. So there's a bit of an overlap between the younger and older patients in terms of characteristics as well. But in
I
terms of
see.
disease itself, it's mostly rhythm issues for the younger adults.
Okay, thank you. That's a very great question, Mobina. I hope you're still there, and you got your answer. I'm gonna go to Hafizul Muhammad Said. Which I think is a good question. The symptoms that you shared, the warning signs, do they occur at the same time or one by one over a period of time, or does it just hit you boom like a tsunami? You
So it
know.
can hit you all at once at the same time. And there
Mm-hmm.
can also be occasions where you don't have all of it, but you only have a few of it. So, say for example, you might be having chest discomfort with palpitations and profuse sweating and nausea. But after a while, you're resting, you don't have that palpitations anymore. You might just have some difficulty breathing, some chest tightness. So, it doesn't have to occur all at the same time. It can occur over a period of time as well. So,
Mm-hmm.
as long as you pick up on the symptoms, then you need to really seek medical treatment. It doesn't have to occur all at the same time.
Okay, fantastic. Very clear. Thank you so much. Hafizul would appreciate it. Um, let's go back to Lutz. Lutz's question is, what does it mean when the doctor says treat as unstable angina?
So that's a very common diagnosis. Yeah, what it
Mm-hmm.
means is that you have got it falls under the umbrella term of acute coronary syndrome. Yeah, what
Mm-hmm.
differentiates unstable angina from heart attacks is that heart attacks, when you do a blood test, you will see an increase in a cardiac enzyme. So when you see that blood test and you see that the results are abnormally high, then it's considered a heart attack, right? The medical term, there are several medical terms for it. It can be either myocardial infarction or non-ST elevation myocardial infarction. I won't go too much into it. But what it means by unstable angina, first and foremost, is that your cardiac enzymes are not raised, right?
Mm-hmm.
So now, as the name suggests, unstable angina, it means that you are having angina while at rest. Okay,
Mm-hmm.
unstable angina can progress into a heart attack. So that is why they treat as unstable angina, meaning your symptoms may have been a bit vague, but again, because of your risk factors, your age, you've got high blood pressure, you've got some symptoms, it's better to treat as an unstable angina. They would admit you to the hospital and they would then repeat some tests, for example, the cardiac enzyme test to see whether it has risen from earlier. If it has risen, then they know that you no longer have unstable angina, but you actually are having a heart attack. If it remains the same, then they may suggest other tests, for example, a stress test or a cardiac CT, depending on your risk factors and age as well. So it's basically starting treatment, blood thinning medications, cholesterol medications, and sometimes even injections within your blood if you're in the hospital.
Okay, got it. Okay, so a couple of people are asking some questions about the test, so I'll try and cover it all. Nambila is asking for ECG. We should start the test at what age? Good question.
So again, you look at your family history. If you've got strong family history, then 20s, 30s, by all means, get a ECG testing done. If you've got strong family history, add on a stress test, even if you're in your 20s and 30s. If you do not have family history of heart disease, no high blood pressure, no diabetes, no cholesterol, 30 to 40 would be good for you to start getting an ECG done.
Okay, got it. And Susan's question is on echo. What is an echo? Because apparently, recently she's got discomfort in the chest, and doctor recommended echo for her.
So an echo is basically an ultrasound, Miss Susan. Yeah. So it's an ultrasound
Mm.
of the heart. It's like basically taking videos and pictures of the heart from different angles. Yeah, we are trying to look at the muscle of the heart. We want to see whether the heart is pumping fine. We also focus on the valves of the heart. We want to make sure that the valves, which are the doors in your heart, open properly when they should and close properly when they should. We also look at the muscles of the heart as well as the chambers in the heart to make sure they're a good size. So if you have discomfort in the chest, an ultrasound is a non-invasive test and it's a very safe test to do.
Okay, so there you go. Hope that answers your questions. Next one is on stress test. Maureen is asking, can we do the stress test once a year? How does that work?
So as long as you've got a stress test done, and if it's a good stress test, yeah, it's not compulsory that you get a stress test every year. Yeah, I advise my patients do the stress test at home, outside in a park, just exercise. That itself is free of charge. You don't have to come every year to get a stress test done. Yeah, but
Mm-hmm,
let's
mm-hmm.
say you have strong family history of heart disease and you just want to be on the safe side. Yeah, some doctors advise maybe once every 2 years do a stress test. But the simplest thing you can do, Maureen, is to just continue exercising. And if at all you have any symptoms, breathlessness, or you feel your exercise tolerance has reduced, that will give you an indication to come in earlier for a repeat stress test.
Right. Okay. I think that's very good advice. Thank you, Doc. Next question is from Yiki, which I think is a good question. How do I differentiate anxiety related chest pain and heart related chest pain?
So it's very difficult to differentiate the two, which is why in
Mm-hmm,
these kind of situations, don't assume it's anxiety. Come and seek treatment with the doctor. Get the
mm-hmm,
doctor to do a blood test, especially a cardiac enzyme related test, an
mm-hmm,
ECG,
mm-hmm.
and then we'll normally do a few other tests to make sure there are no, like for example, the echo, which is ultrasound of the heart. We might do a CT scan of the heart. Once we've confirmed that there are no issues with the heart, then we would say it's anxiety related. We can't immediately say it's anxiety related just by looking at the patient. At least get an
Okay.
ECG and blood test done.
Okay, got it. So you can't really tell, just go in and get it checked. Better be safe than sorry. Okay. Hannah's questions, we've got three more questions before we go into the quiz. Hannah's question is, do you think giving patient medicine like aspirin is good as an emergency action in this case? Just wondering what happens if you give aspirin when you think, oh, yeah, I got chest pain only.
So if you are
Does it
having
help?
those symptoms, yeah, if
Mm.
you're so that's actually part of the treatment. Actually, we give a high dose of
Ah.
aspirin. Yeah. So
Mm.
if at all, again, if you have strong family history of heart disease and your symptoms are very typical, and if you have aspirin on board with you, just take in at least about 300 milligrams of aspirin. That's what we normally give in our emergency setting. Plus, it's
Mm-hmm.
short acting, right? The only side effect of aspirin is that you may have some bleeding tendencies like bruises and all, but that's only if you're on long-term aspirin. So just a one-off aspirin, that's not really harmful. So if you have
Mm.
access to aspirin, symptoms are typical, it's going to take you a while to reach the hospital. By all means, 300 milligrams of aspirin should be good.
Okay, so we'll go to two more questions from Aston. She's asking typical symptoms of women. Does sudden rise of cholesterol contribute? And what is blood pressure marker? Is it done through blood tests?
All right. So the first was about the first question was about typical symptoms. Okay,
Mm.
so as I mentioned earlier in the slides, so some women tend to have atypical symptoms, right? But
Mm-hmm.
again, based on your risk profile, if you are high risk, yeah, above the age of 40 with family history, if you are postmenopausal, you get your ECG and blood test done, right? Sudden rise of cholesterol. Now, I've not seen a sudden rise of cholesterol, to be honest. Most of the time, cholesterol has been most of my patients, cholesterol has been high for quite some time. I've not seen a drastic increase in cholesterol out of the blue. However, for some patients who have been diagnosed with cholesterol, high cholesterol, and they take medication, statins, for example, and after about
Mm-hmm.
3 to 6 months, it comes out nicely, and then they decide to stop, then it'll rebound back. That can lead to a
Mm-hmm.
rebound in the cholesterol levels. So I've not
Mm-hmm.
seen this sudden rise of cholesterol. Another important thing for you to remember is that it's also important to check on your thyroid function, because if you've got very high cholesterol levels, it could be due to a weak thyroid. So that's also something very important to look into. And the second question was about blood pressure marker. So your blood
Yes.
pressure marker is basically it's not done through a blood test. It's what you have at home, your blood pressure machine. Yeah, you just have that
Yeah.
machine that just fixed onto your arm, and then you press the button that gives you your blood pressure reading, right? It's not done through a blood test. However, when your blood pressure is not well controlled, then yes, you may have in the long run problems with your kidney, right? So you may be able to pick up certain issues with your kidney in terms of your renal profile or kidney profile, but it's not a blood test. It's just a normal blood pressure reading. So normal blood
Yeah,
pressure
that's
reading should be
mm,
140. Yeah, correct. Yeah,
okay. That's the one with the pump and they
yeah,
squeeze your
correct. Yeah,
arm or something
yeah,
like that.
yeah,
Right? Okay.
yeah.
Thank you so much for clarifying that. Before we go into quiz, Mamoni, your question, which is how we know, doctor, how we know what? If you can clarify the questions, we'll be able to answer it. So do let us know in the comment section, right? Okay, so who's excited to win prizes? Let me know because it is quiz time right now. And but before we start with before I give you the quiz questions, here are the rules. As mentioned earlier in the earlier part of the show, we've got three heart screening packages worth 749 ringgit up for grabs. What you need to do first, you got to be sure to share this video out at least 3 times, and remember to set the share post to public so that everybody can see. And then you answer the three questions that we're going to be showing on the screen in a single comment, and you're on your way to win prizes. So let me repeat that. First, share this video 3 times and set the reminder post to public so everybody can see. And next, answer the three questions in a single comment. And the winners will be selected based on the correct answers and the shared posts. All right. So let's take a look at the first question. Right. True or false? Only people above 60 get heart disease. If you were tuning in from start, you would know. If you know the title of this episode, you would know also. All right. True or false? Chest pain is the only sign of heart trouble. If you were listening to the Q&A, you would know. And the last question is you can reverse some heart risk with lifestyle changes. True or false? All right. So let us know in the comment section. We'll just pick the winners based on the correct answers and the shared post. So let's get back to our Q&A, shall we? All right, Doc. So Jesse has a question. It's very simple. What about supplements? Does it help if we take supplements for the heart? And
So
what sort
so
of
far
supplement?
yeah, it's a good question as well. In
Mm,
cardiology, so far, when it comes to supplements, it's mostly fish liver oil supplements, fish liver oil
mm,
capsules that have been proven to improve your cholesterol profile. So, if at all you want supplements for the heart, I think fish liver oil capsules help. And another thing is that if you are on statin medications, because statins can cause muscle breakdown or muscle aches and muscle pains, then this enzyme supplement called CoQ10, if you've heard of it, CoQ10
see.
actually helps, yeah, CoQ10, that actually helps to
Mm-hmm,
improve your levels of CoQ10, and it
mm-hmm,
minimizes the side effects of statin medications. So in
I see.
cardiology, mostly it's these two supplements, if at all you need them. If you've got good cholesterol profile, healthy eating, exercise should suffice. It's not a must that
Okay.
you take supplements for the heart.
Okay. So, since we're talking about statin, Lutz is asking, what is the safest cholesterol medication? Many of us are afraid of taking statin. Can we stop taking statin after the cholesterol levels go down? What's your suggestion, Doc?
So, Mr. Lutz, there is no safest cholesterol medication. I would say that all cholesterol medications are safe. Otherwise, you wouldn't be prescribing them. The only issue is that us being us, we respond differently to different medications. So I might
Mm,
have patient A who's doing well on a particular statin medication, but patient B might be experiencing side effects that patient A doesn't have. So it's all about individualizing the treatment and care. What the main side effect of cholesterol medications are actually muscle aches and muscle pains. Yeah, can we stop taking statins? So the thing is, after your cholesterol levels go down, because statins suppress an enzyme in your liver that produces cholesterol. So when this enzyme is suppressed while taking statins, your cholesterol levels are beautiful. But the moment you stop taking your statins, the enzymes are no longer suppressed and they start reproducing these higher cholesterol levels again. So you tend to have a rebound in your cholesterol levels. It will go up eventually if you stop taking your cholesterol medications.
Okay, so there you go. Hope that answers your question. Yeah, Lutz. Okay, next question is from Shazan Low. She is asking, or he is asking, is premenopausing, I'm assuming it's a she, is premenopausing woman age 35 onwards has a stronger effect with heart problem? Is it normal to menopause, premenopause at 35? Just wondering. That would be the add-on question. Hi, Doc. Did you get the
Yes,
question?
hi, hi. Yes, I did.
Mhm.
Yeah,
Okay.
yeah. So if you're premenopausing at the age of 35, yeah, I would imagine that there's a reason why you are premenopausing at
Going through
quite
it.
a young age, actually. Yeah.
Mhm.
So the average mean age in Malaysia is around 51. Yeah. So let's see if you are going through menopause. Yes, your risks of having heart disease becomes higher, right? They say that
Mhm.
while you're during the menstruating period, those years, it is slightly protective against heart disease. Yeah, so women who are postmenopausal tend to have equal risk of having heart disease as men. So there is a question about hormonal therapy, hormonal treatment. Yeah, so some doctors are quite loud advocates for hormonal treatment, replacement therapy for this group of patients because you want to minimize your risk of having heart disease in the long run.
Okay, got it. I think statin was for cholesterol, right? Just now, Doc. So I
Yes,
think
correct.
Jesse's question was actually answered by you
Yeah,
just
yeah,
now, kind of thing.
yeah.
So we'll go to the next one. Richard is asking, "Hi, Doc. Is Monjaro one of a cure for heart disease as it helps with visceral fats? What is that, Doc?"
So Mounjaro is one of the latest medications that helps reduce obesity. It's an anti-obesity medication. It's a
Right. Okay.
two-in-one combination medication. It's actually quite a good medication. Is it a
Mm-hmm.
cure for heart disease? Now,
Is it?
if let's say you are an obese person and you want to get your weight down to a healthy level, then yes, it's one of the treatments to reduce your risk of having heart disease. I wouldn't say it's a one-all cure for heart disease, but yes, it reduces your risk of having heart disease. So if you're obese, that helps. If you're diabetic, it helps improve your sugar profile. It reduces
Mm-hmm.
your risk of having disease, but it's not a
Mm-hmm.
one-off cure for heart disease.
Okay, because it depends on what you do and what you eat as well. But it can definitely help you lose weight, right?
Definitely, definitely.
Yeah, and with that, the risk goes down. Okay.
Yep.
Connie Francisca Joseph is asking, is it possible to get rheumatoid heart disease if you are age in your
Age of
40s?
40.
Hmm.
So, rheumatic heart disease is a condition that affects the valves of the heart, the doors of the heart. It's
Mm-hmm.
actually due to an infection that you might have had in your schooling days, pre-teens, or maybe even when you were a teenager. And it's actually due to an infection of the throat. You might not have eradicated it properly, but your body has produced antibodies that act against this infection. But those antibodies also attack the valves of the heart. So rheumatic heart disease is quite rampant in Malaysia, especially in East Malaysia, in Sabah and Sarawak. Yeah. So I have seen patients in Sabah having heart disease, rheumatic heart disease, even in their 40s. So it is possible. Yeah, especially in East Malaysia. Yeah.
Okay, got it. Okay, Doc, is we're at 4:11 now, so I'm just gonna go with a couple of questions because most of them are from Lutz anyway. But before that, Hafiz has a question. Moderate intensity is equivalent to VO2 max level 2. What is that question, Doc? Is this exercise? Moderate
So
intensity?
moderate intensity. So that is actually a cardiopulmonary testing. Yeah. So I seldom do
Okay.
cardiopulmonary testing here. What we
Mm-hmm.
do is exercise stress testing, and by moderate intensity, in terms of exercise stress testing, it's about a METs or metabolic level of above 4 to about 7. 7, 8 would be your METs intensity. In terms of VO
Mm-hmm.
max level 2, because I don't have much experience with cardiopulmonary exercise testing, I can't answer that. I need to look into that. But in
Okay,
terms of
got it.
stress testing itself, metabolic rate
Mm-hmm.
of at least about 5 to 8.
Okay, so the last few questions are from Mr. Lutz, who's fantastic with his questions. So we're going to do like a rapid round fire. Are you ready, Doc? So first
Right.
one is I'm used to original hypertension medication, but the government has given me government hospital, not the government, given me some medication, but generic. So does it make a difference?
So you would be the best person to answer that question, Mr. Lutz. Is your blood pressure well controlled now? If it is well controlled, then the medication has done its job and there shouldn't be any difference. If at all you feel that
Mm-hmm.
your blood pressure is not well controlled on the generic, then yes, there would be a reason for you to revert back to the original.
Okay, got it. But I would assume the generic drug is just a different name compared to the original, right? Or is there
The,
any
the
difference?
compound, yeah, the compound is still the same, right?
Uh-huh. The
So
brand
that's
is
why a lot
different.
of a lot of government hospitals are switching to generic, and they work just
Mm,
fine. Of course, there are a group
mm.
of patients who may have certain side effects, so it's good for them to monitor
Ah,
them.
okay. So always check the side effects, all right? Okay, so next question is can he still eat eggs if his cholesterol level is borderline?
Yes, you can. You can eat eggs. You don't have to deprive yourself, but together with that, you can also eat lots of vegetables and
I love
lean
that.
meats.
Yes. Okay, got it, Mr. Lutz. Okay. Vegetable is your best friend. Okay, two types of blood thinners are prescribed. Why? Are there any long-term side effects? Good
All
question.
right. Yeah. So when you are prescribed with two types of blood thinners, then you know that that particular patient has had an acute coronary syndrome, which I mentioned earlier is either an unstable angina or a heart attack. So for the first year, after an episode of chest pain or chest discomfort requiring hospital admission, doctors will start you on two blood thinning medications to reduce the risk of further complications down the line. That's for the first 2 years.
Mm-hmm.
After the first year you'll be only on a single blood thinner medication, right? Long-term
Mm-hmm.
side effects, so again you'll be on two thinning medications for 1 year. The side
Mm-hmm.
effects of blood thinning medications are easy bruising. When you're brushing your teeth, you may have bleeding from the
Yeah.
gums. Yeah, so
Mm-hmm.
you need to be extra cautious. You might also have some gastritis. So it's advisable that when you're on two blood thinning medications, you take it after a meal. If you only have a
Mm-hmm.
very small breakfast or a very tiny breakfast, then you have it after your lunch. It's also advisable that you take a gastric medication if you have symptoms of gastric pain or discomfort. Uh,
Mm-hmm.
those are the only two long-term side effects, bruising and bleeding.
Okay, got it. Thank you, Doc. That was so informative, even for me, because I'm looking at my dad's medications as well, kind of thing. All right, so
Right.
let's find out what the correct answers to the quiz is, and let's find out who our winners are. So, who's ready, kind of thing. Right. So, first question, Doc. Only before we give you who the winners are, let's see what the correct answers is. Yeah. So, only people above 60 get heart disease. True or false, Doc?
false. Anyone can get heart disease at any age.
Okay,
The
that
whole
he
idea
also
of this
can.
talk.
Yeah. And if you vape, it's higher. Chest pain is the only sign of heart trouble. True or false, doc? The answer is false. While we're waiting for Doc to get back. Yeah. So chest pain is not the only other sign. It comes with a few other symptoms. Doc, so the answer is false, right?
False, yes.
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 Okay. And the last question is you can reverse some heart risk with lifestyle changes. True or false, Doc?
True. Very
Okay.
true.
And it's very successful if you actually take action, the correct action.
Yeah, definitely, definitely. Makes a huge change. Yeah. You can't change
Makes a huge
genetics, but
change.
you can definitely make
Definitely
changes to your
take action.
lifestyle
Okay.
changes. Yep. Yeah.
All right. So, and who are our winners? Let's check it out. Right. So, congratulations to our winners. They are Muhammad Hafizul Muhammad Said. Worth it to ask that question just now, right, Hafiz? Puan Maz and C Stars. Congratulations to our winners, Muhammad Hafizul, Puan Maz, and C Stars. All right. So, congratulations. We will be contacting you after this within a day to get your details. So, be sure to check your Facebook Messenger. If you don't win the prize because it gets sent to me. No, just kidding. All right. So thank you so much, everyone. Thank you, Doc, for today as well. Definitely learned a lot. What did you guys learn today's episode? Please share in the comment section. For me, definitely just get screening. Don't assume prevention is better than cure. And if one of your family members, goes in for a surgery, a heart surgery, the rest of you better do like a joint family heart screening thing. Okay. And you can definitely go to Dr. Prem kind of thing. All right. So thank you so much, Doc. Any last
Thank you.
words for
Thank you.
our audience out there?
Wishing all of you a great 2026. I wish you use this year to focus on your heart health, not just your
Mhm.
heart health, overall health. If you have any symptoms, go to the nearest hospital, seek treatment with your doctors. Don't be afraid of doctors. Sit down and chat with them, and you can work things through and see what's the best option for you in terms of treatment.
Exactly. See, Dr. Prem, so nice, right? Nothing scary about him, right? So sweet, some more. Explain all your questions and answer all your questions. So thank you, everybody. We hope you had a wonderful time joining us today. We hope you appreciate the tips, the info, and the insights for today's show. If you know anyone who might need it, please share this video out because you never know who it's going to make a difference to. And do give us a lot of likes and love while you're at it. Thank you again. Till then, take care of yourselves and each other. And be sure to get those screening, your health screen as well. Yeah. Thank you. Goodbye from us today.
Take care. Bye bye.
Thanks.